Welcome to Round Rock Neurology. This is the headache lecture. Please watch the entire video. The video contains important information for your appointment in neurology. You've been referred to neurology for your headaches. While in the clinic, your providers will be Andy Falden and Melinda Moore-Gottschalk. Patients that understand their headaches, or really any chronic condition, tend to improve faster. That is why Baylor Scott White has lectures on various conditions available to our patients. This lecture is an abbreviated version of our in-person lecture. We cannot include all of the information we would like to give you, so I encourage you to attend a free lecture at the Baylor Scott White Round Rock Cancer Center. You can make an appointment for that in-person lecture through the call center or when you are called to make your first appointment. Your providers in the headache clinic want to be prepared for your visit. This form enables the providers to have your headache history prior to your visit, so time during your visit can be spent on education and treatment rather than discovering your headache history. Please fill the form out completely. Place N/A on every area that does not pertain to your history. Please circle yes, no, or not sure by every medication. Then fax the form to the number on the screen. Send as an attachment to the email address showing on the screen, or bring the form to Baylor Scott White Round Rock Cancer Center, 4th floor, and hand it to the person at the receptionist desk. You'll be contacted regarding your appointment. To avoid delay in scheduling, be sure to fill out the form completely. It will be returned to you if not complete. Please be sure your contact information is up to date with Baylor Scott White and in MyChart. You can bring the form in to the Baylor Scott White Cancer Center on the 4th floor for processing. It is important for you to be early for your appointment in the neurology department. If you check in 15 minutes before your appointment, the medical assistants will have time to bring you to your room, take your vital signs, and you can complete any needed forms and be ready for your appointment at the stated appointment time. If you arrive at your appointment time, those items have to be completed prior to you being seen, which will cut into your allotted time and may not allow enough time for your actual appointment. Your first appointment will be approximately 1 hour. But to maximize your time in the clinic, please arrive 15 minutes early. Why watch this video? Patients that understand their condition, no matter what the condition is, have more success in controlling their medical problems. This is why Baylor Scott White offers free lectures on multiple conditions. This video is brief, a look at your headaches and a cause of your headaches, as well as our treatment options. Your providers will give patient information each visit, but for a more in-depth look at your headaches, please sign up for one of our free lectures. They are conveniently scheduled on one Tuesday morning and one Thursday afternoon a month at the Baylor Scott White Cancer Center. Migraines and headaches are nervous systems that have become very sensitive. Before you had a headache, your nervous system was not as sensitive as it is now. For some reason we may never know, your brain has become sensitized. Our job is to give you tools to desensitize the nervous system. When the nervous system is sensitized, it doesn't tolerate change very well. We call those stressors. These stressors can cause normal everyday things to cause headaches. For example, bright or flashing lights, certain smells, or loud noises and stress, to name a few. Whatever the reason, there are ways to treat your headache, but you need to understand it first. There are many types of headaches: chronic, episodic, or mixed. Chronic headaches. The most common type of chronic headache is a migraine headache. Other types of chronic headaches could be medication overuse headaches and tension headaches. Without treatment, these headaches can last more than 15 days a month and more than 4 hours a day. Episodic headaches. Examples of episodic headaches are migraine, cluster, hypnic, or primary stabbing headaches. These types of headaches last less than 14 days a month and less than 4 hours a day, even without treatment. Occipital, frontal, and temporal headaches can be chronic or episodic. These headaches describe the location and the structures involved in these headaches. Post-traumatic headaches can be caused by physical trauma or an emotional trauma. So where does it all begin? When the trigeminal ganglion becomes sensitized, a migraine can begin. It will then send out pain to all these areas: the forehead, the cheek, and the jaw. The occipital nerve, lesser and greater, goes to the back of the head and the top of the head and can trigger pain in the neck and cervical region. There are blood vessels in all these areas, and blood vessels can expand to help with the blood flow. However, this expansion can cause compression on the nerves and worsening headache. The white arrow coming from the bottom represents a secondary cause of headaches. Tension, stress, and neck injuries, anything that can affect your neck and your shoulders, can start in the neck and shoulders and then work its way up to your head and engaging the nerves and causing a headache. Trauma is the most common singular reason for a migraine at 20%. But hormonal issues, menstrual cycle, puberty, childbirth, pregnancy, menopause, equals around 47% of migraine headaches. Emotional aspects with abuse, death of a loved one, divorce, and separation account for about 14% of headaches. So you can see why migraines are the most common type of headache. So in summary, migraines and headaches are real. Your brain has a filtering process that is supposed to filter out environmental stimulus or excess nerve pulses. When your filtering system isn't working properly, all the impulses and information from your environment are getting through, resulting in a headache. Therefore, normal light, noise, smell, and other stimulus set off a headache. Even your hair can hurt when this is happening. It's also important to know that headaches are a chronic condition. So if you were diagnosed with another chronic condition, say diabetes or hypertension, you would have to make some changes in your life. You may have to start some medications, change some other things like what you eat and drink, and perhaps start exercising. It is the same with migraines and headaches. It will require some changes in active participation on your part for needed improvement. Starting with the headache diary, an important first step in managing your headaches is knowing how many headaches you have every month. A headache diary is the most important tool to combat your headaches, and it is in your control. You have to keep the diary. Keeping an accurate diary helps us help you. We will know if you're getting better or worse, if our treatments are working, or if we need to move on to another treatment. It helps us with insurance documentation also. But you don't have to keep in this format. You can keep a headache diary on your phone. You can use it on a calendar. You can even keep a headache diary on a blank sheet of paper. The important thing is the information. These are the questions we are going to ask you each visit when you come to our office and you fill out a form reporting how many headaches you had a month, how many were mild, how many were moderate, and how many were severe. Here are some apps you can download for your mobile device. They are available in all kinds of mobile telephones, but they're also available on computers. We like Migraine Buddy the best, but use the one that works for you. We can talk about them more at your appointment. There are triggers for migraines and other headaches. The items on the left may be causing your headache, especially migraines. The ones on the right, any kind of headache. If you eat or drink these items or take medications on the right, let us know at your appointment. You may have noted them on your intake form also. But maybe you don't know if they're causing the problems with your head. A headache diary will help us discover these triggers if you keep an accurate diary. Caffeine is so important, we'll include it on a separate slide. Speaking of caffeine, in the past caffeine was used to fight headaches. And if you have 1 or 2 headaches every couple months, it may work well for you. But caffeine has been found to be counterproductive if used chronically. Caffeine can increase the sensitivity of your nervous system because it's a stimulant. Patients drinking caffeine multiple times a day, even 2 times a day, are increasing their chance of getting a migraine. Therefore, it is essential to wean off of caffeine and start slowly. Start using a non-caffeinated option. Limit caffeine you drink or eat to before 12 noon. Will also help you with sleep. One of the most important things you can reintroduce into your diet is water. Prodrome are symptoms patients have before a migraine. Do any of these seem familiar? What about the aura? A little bit more dramatic neurological symptoms. Regardless of whether you have a prodrome or an aura, most patients have something that signals they're going to have a headache. If you keep an accurate diary, you'll be able to discover yours. We're going to make suggestions for changes in your lifestyle, diet, and sleep to help you control your headaches. You must be willing to help yourself by following these suggestions. At the end of your first visit, we will develop your game plan. The game plan will outline your treatment plan and contain several elements. Stress can cause many health issues, including headaches. To combat stress, you have to make some changes. These changes could start with practicing deep breathing exercises every day, 10 minutes to completely relax and empty your mind. Try to plan an activity that is fun or relaxing every week. These simple steps can help reduce your stress and improve your health. Sleep and wake times. Patients with headaches usually sleep too much or not enough. The goal is 7 to 9 hours of sleep. We will discuss your sleep and make suggestions or treatments to improve sleep. But for now, start thinking about your sleep and its possible relationship to your headaches. Do you miss or skip breakfast, lunch, only have dinner? Hypersensitive nervous systems cannot tolerate missing meals. The time between breakfast and dinner, or between dinner and breakfast, is sometimes over 12 hours. Missing breakfast could increase your chance of developing a migraine. You must eat something in the morning, preferably something with protein. Blood sugar rising and falling can be a trigger for migraines, so eat 3 meals a day with small snacks to keep the blood sugar as level as possible. Fasting can lead to headaches in relation to blood sugar levels changes or from stress hormones, although the exact mechanism is not known. Sometimes foods are trigger for migraines and headaches. Check out this website for information on recipes devoid of migraine triggers. Exercise is important. Add 20-minute walk 3 to 5 times a week will decrease the sensitivity in your nervous system. Your body will start releasing a natural substance called an endorphin at 20 minutes. These are the feel-good hormones that regulate pain and mood. So try to get some exercise. Even just walking around the block and building from there is a great start. We have a structured treatment protocol that will incorporate vitamins and minerals as well as prescription medications to treat your headaches. First step is prevention. If we can keep headaches from starting, we are ahead. If you get a headache, you will begin the stratified approach of attacking that migraine. Sometimes you can't get rid of the headache alone, and you may need a rescue treatment. We have very up-to-date methods for preventing headaches, as well as treating acute headaches. Many of the same medications are used for many different types of headaches, with some variations. If you have more than 3 headache days a month, we will suggest a prescription medication for the prevention of migraines. You will take it daily. It does not cause medication overuse headaches, and these medications desensitize your nerves and your brain. Good prevention actually helps your acute medications be more effective. Many of the same medications are used in migraines and other headaches with variations. Medications can range from vitamins and minerals to prescription medicines. The medication suggested will be tailored to your problem. At your appointment, we'll give you prescriptions or ideas on what to do when you have an acute headache. This is what we call a stratified approach. It is important to follow this guideline so that the acute medications work well for you and you don't find yourself overusing them. These medications are taken at the mild, moderate, and severe phase, but preferably at the mild phase to keep the headaches from becoming severe. You will take these medications at the first sign of the headache when the prodrome and aura appear. Remember, the head pain is just another symptom of the entire headache syndrome. So treat it at the earliest symptom, maybe when you have nausea or light sensitivity, or whenever you think, I'm getting a headache. Unfortunately, overtaking NSAIDs, which consists of ibuprofen, naproxen, Aleve, Mobic, the triptans, Imitrex, Maxalt, etc., and Tylenol will actually cause you to have increased headaches. So treating early is the key to keep the headaches from getting out of control. We will tell you when to take the next dose. Please follow our advice closely for best results. Good news is there are medications you can take that don't cause medication overuse. This includes nausea medicines, muscle relaxers, and additional magnesium. Speaking about getting out of control, headaches are like forest fires, raging, out of control, consuming. If you wait to treat your headache until this stage, it takes more medicine and you are less successful. It's like putting a bucket of water on a forest fire. You may make it a little less, but it's likely to flare back up. But if you treat your headache when you first feel it coming on, during the prodrome and aura, it'll be more like a campfire. The medication we give you will be enough to completely treat your headache with no rebound. We have other options for rescue if this headache doesn't go away. We are available to help you with your headache crisis with nerve blocks and trigger point injections, as well as ordering IV infusions in our office or the infusion center. Let us know if you are driving yourself for any of these treatments. We may need to eliminate some of the medications that are sedating. Sometimes we will give you intramuscular injections of Toradol or a nausea medicine for a rescue visit. Again, if you are going to get these medications, you'll need to have a driver. We also do Botox for those that meet criteria. There are many medications prescribed for headaches. Research has shown that these medications will increase your headaches if taken chronically. We do not prescribe these medications for headaches and ask you not to take them for headaches if you are to have your headaches treated in this clinic. These medications will increase headaches if taken in excess. But these medications, if taken within reason, can be used in our protocols to control your headaches. Hyperalgesia medication overuse headaches happen when overtaking medications for pain. The nervous system increases in sensitivity until normal stimulus causes pain. The only way to stop hyperalgesia and medication overuse is to stop taking the medications and let your body detox. Although you may take these medications chronically for other types of pain, it is important to know that headaches are not treated as successfully on pain medications if taken more than 12 days a month. This includes all anti-inflammatories, triptans, narcotics, and Tylenol. You may ask then, what do I do about my pain? Remember, all pain is increased with these chronic medications. So weaning and then not taking them as often should decrease your pain overall. But if you still have to take them more than 12 days a month and your headaches are uncontrolled, then you will know that treating the chronic pain is worsening your headaches. At some point, you may need to choose which problem is worse, the chronic pain issues or the headache. Pain management is on the third floor of this building, and they would be able to help you do the same treatments that we can do, except for they can also do treatments to treat your neck and other pain problems. Seeing them for your headache would not violate pain contracts that you may have with another pain doctor, as they would not give you narcotics. Physical therapy is an important step in your treatment. We will most likely recommend some sort of physical therapy in your treatment plan. PT can also help with ergonomics to help your posture to avoid headaches from poor sitting and standing habits. Baylor Scott White also has acupuncture, massage, and chiropractic treatments available to help reduce and treat your pain. So the next steps are for you to be willing to give up the medications we discussed. You must be willing to actively participate in your treatment plan by following the instructions given to you during your visit. And you have to have patience. Nothing happens in one day. Treatments for your migraines will take time to work. American Headache Society gave the following recommendations. You have this sheet in your folder, or you will be given a folder with this sheet. But the only one we did not discuss in the lecture was hydration. Many people find that if they are dehydrated, it will increase their headaches and may even cause more headaches. Being well hydrated is whatever amount of water it takes for you not to have a dry mouth, and it's something you should start today.